Hello, this is Dr. Grande. Today's question is, what are the risk factors for intermittent explosive disorder? Now, intermittent explosive disorder is a mental health disorder, and I reviewed the symptom criteria in an earlier video, so I'll just give a brief description of that disorder here. What we see with intermittent explosive disorder is recurrent outbursts that represent a failure to control aggressive impulses. Now, these outbursts can be verbal or physical. There can be destruction of property or assault involved. The behavior outbursts we see with intermittent explosive disorder are not premeditated, and they're not done for some tangible objective. So they're not done for trying to obtain money or fame or some other goal. So there's a spontaneous component and really a mysterious component to this disorder. We don't know what causes these outbursts to occur, and we don't know what causes the disorder to occur. There are several risk factors, however, and that's what I'm going to talk about here. Now, sometimes when we look at risk factors, we see that the association to the development of the disorder is fairly weak, and clearly it's not causal. Other times we look at risk factors and we think, well, this may represent some sort of causal link. These risk factors may lead to the development of intermittent explosive disorder. With the risk factors I'm listing here, we really don't know if they're causal or not. Some of them have a fairly weak association, as I mentioned, and we believe the causation of intermittent explosive disorder is quite complex. So really we don't know what causes it, we really just have a list of risk factors. So when we look at the risk factors, the first one we look at here is genetic. We know that individuals who have a family history of intermittent explosive disorder have a greater probability of developing the disorder. Also, if there's a family history of mood disorders and substance use disorder, then there's a higher probability of developing intermittent explosive disorder. We know that brain functioning has been linked to intermittent explosive disorder, specifically head trauma and abnormalities in brain chemistry. We also know that brain infections, inflammations, and seizures have been linked to the development of intermittent explosive disorder. A number of environmental factors have been linked to the development of intermittent explosive disorder as well, including exposure to violence, childhood trauma like abuse and neglect, being exposed to life-threatening situations, having an unstable family environment, being exposed to alcohol or drugs. This risk factor has also been associated with predicting the severity of intermittent explosive disorder, with the use of multiple substances being associated with a higher level of severity. We also see that the presence of certain personality disorder traits have been associated with intermittent explosive disorder, specifically narcissistic, antisocial, borderline, and histrionic personality disorder traits. Also, the presence of ADHD has been linked to intermittent explosive disorder. We know that males are affected by intermittent explosive disorder at a higher rate than females, and we also know that the behavioral outbursts that are part of intermittent explosive disorder are much more likely to occur during a period of stress. So there are a number of risk factors here for intermittent explosive disorder. Some of them may have a causal contribution, as I mentioned, but we really don't know. And research continues to try to figure out what is leading to the development of this disorder. I hope you found this description of the risk factors of intermittent explosive disorder to be interesting. Thanks for watching.